Now, shifting our focus to one of the main health concerns which has cropped up in multiple states across the country, and now the center has also issued advisory on it, and that is about mucormycosis, also known as black fungus. Now, the center has said that the black fungal infection, which in fact affects COVID patients even after they recover, that can, if it is left untreated, can in fact even prove fatal. For that reason, the ICMR has in fact issued an advisory on it as well, because the infection is found in COVID patients or even COVID survivors who have uncontrolled diabetes and weak immunity. In its advisory that the ICMR has released, it said that the fungal infection mainly affects people who are on medication, and that reduces their ability to fight environmental pathogens. The disease can be managed by controlling diabetes, discontinuing some drugs, and also reducing the use of steroids, which we know is given in certain cases by doctors when they are dealing with COVID patients, especially even at some people who are in home isolation as well. Now, in its advisory, the center has released a list of do's and don'ts to curb the black fungus infection in patients. Center said that the high blood sugar in patients must be controlled and that the blood sugar level in patients must be constantly monitored. It has also highlighted that steroids must be used judiciously. And among the mistakes that should be avoided is to miss out on warning signs and lose crucial time to initiate treatment. Right, let me go across to some health experts now in order to find out what more that people can in fact do in order to prevent black fungus infection as well. I'm joined on the broadcast by Dr. Shalabh Sharma. He's a pulmonologist and senior ENT surgeon in Sir Ganga Ram Hospital in the national capital. Dr. Sharma, thank you so much for taking out your time and speaking to us here on Mirror Now. What would you suggest? Because we've seen that Ganga Ram was actually one of the first hospitals which talked about the black fungus infections which were seen in patients in the second wave specifically. And what we were in fact seeing in some states was that compared to last year, there were a few cases last year as well, but this year it is turning out to be more fatal. Is that correct? What would you say?
I would say that, first of all, a correction. I'm an ENT surgeon, not a pulmonologist at Gangaram Hospital. Regarding the mucormycosis or the black fungus, cases were seen last year also. This year, we are seeing more cases because, frankly, the number of caseloads or the number of cases is so much higher this year as compared to last year. And in this year, this viral infection, because of the lack of availability of hospitalization at the right time and oxygen, a lot of people are on home care or are on medication started by the doctors to help them through this difficult time before they can or until they can get a bed. And one of the main medications that we give in COVID-19 is the steroid, because the moment you have, the COVID-19 affects us in some ways. One of them is that you have a COVID-19, a fulminant infection right in the beginning, a respiratory distress, and you need ICU care. But the usual, what we are seeing is that the patients are fine in the first week, and in the second week, because of the immune reaction of the body, their swelling takes place in the lining of the lungs, and then the oxygen saturation drops. So these patients require steroids to be started immediately at that time to prevent the inflammation from increasing. They raise the blood pressure, they raise the blood sugar, and once the sugar is raised, and especially in patients who are already pre-diabetic or diabetic, sometimes it is difficult to control the sugars easily. And if these patients are maintained on intravenous or oral steroids for a longest time until they recover from the COVID-19 reaction, during that time they are more prone to getting the mucormycosis infection or any actually supra-added infections take place, including bacterial and fungal. One of them is mucormycosis. Unfortunately, mucormycosis is also a very deadly infection.
Right. Doctor, what a lot of patients at home, either in home isolation, as you were saying, or even those who are recovering from COVID would like to know, how exactly do they prevent black fungus? Is there something that they can actively do?
If they have any nasal symptoms during the infection of the COVID or post that, then using a saline nasal spray is a very good idea to clean out the nose, because saline nasal spray keeps the nasal passages and the sinus drainage pathways clean. And essentially, mucormycosis and also avoidance of unnecessary antibiotics and antifungals during the treatment phase with steroids. Because, for example, if we were to give a lot of antibiotics to a patient on steroids, the antibiotics will kill all the bacteria which are there in the body, including the normal commensal bacteria, which are actually protective. And it's when the normal commensals are absent that these the newer or the different variety of infections, which are bacterial or fungal, grab a hold and then start growing. So it's a good idea to keep the medication to the minimum requirement, and also to maintain the sugars, keep a close watch on the sugars, and to make sure that any patient who has other immunosuppressive disorders, like patients who have kidney transplant, who have had a kidney transplant, or those who have kidney failure, are on dialysis, or any patient of autoimmune disease who is already on some immunosuppressive drugs for that disease or on steroids, all these patients need expert care and expert guidance during this time. And they have to take all the medication only under expert guidance. I think I've had calls from patients telling me from far away that they and their friends have already started steroids, thinking that it's going to prevent them from getting the COVID infection, or that if they get it, they will have a mild infection. And then they are shocked when I tell them that if you don't stop the steroid, you get an infection with COVID, chances are you will not survive because you've taken it at the wrong time.
Right, Dr. Shalabh Sharma there from Sir Gangaram Hospital in Delhi, explaining what we can do in order to prevent black fungus infections as well, even if you're recovering from COVID. Thank you so much, Doctor, for taking out your time and speaking to us. Let's also take a look at what other news are making headlines across the country.